E is hemostasis, and we'll get to hemostasis. We'll discuss it in lecture on Monday. You can read over it over the weekend too, but I want you to kind of work through those questions as you read through the chapter there on blood clotting. You should know pretty much all the major factors that are involved, the major concept, and this whole networking that's involved in the blood clotting that is taking place when you damage a blood vessel. So there's just a few short questions there that you can answer dealing with blood clotting. Okay, and then there's a couple diagrams after that. Well, when you're done with the blood typing and you've reviewed and you're all ready, then move on to Lab 13. Lab 13 is the start of blood vessels. And so one of the first things you want to do is get the slide out of your artery and your vein. And it's one slide, it's got the artery and vein both on the same slide. And you need to, first off, make sure that you can differentiate between an artery and a vein. So here's one, and there's another. Which one's the artery, which one's the vein?
Artery and vein.
One on top, the thicker one is the artery, and the thinner walled one is the vein. Now don't get it confused saying, oh, well, this one's bigger, it's got to be an artery, this one's smaller, it's a vein. Because the reality of it is, most of the time, when you look at an artery and a vein next to each other, the vein's typically larger than the artery, as far as just general structure. But the wall thickness of the artery is always going to be thicker. Okay, the walls of the veins are going to be very thin, whereas the walls of the arteries are going to be very thick. And why is that? It's all based on pressure, exactly. The blood being forced into the arteries need to be able to expand and constrict. The blood going through the veins is very low pressure. It's just being pushed slowly, and it's more of a flowing of blood through the veins. So the walls can be very thin. But when we look at this, you need to also be able to identify the tissue layers of the artery and the vein. They're called tunicas. Okay? Tunica means tissue. So we have the tunica interna, or tunica intima, which is your endothelial lining. So inside. What's this space called in here? Lumen. What fills the lumen?
Blood.
Blood. Okay, so the first layer of the actual wall, this dark line, is your tunica intima, which is made of endothelial tissue. Simple squamous endothelial tissue. The next layer is, or series of layers, is the tunica media. So all this kind of lighter pink in the middle is all your tunica media. The tunica media is going to be made up of smooth muscle and elastic tissue. Smooth muscle and elastic tissue, that's what allows it to expand and also to constrict if it needs to. Okay, when we talk about blood pressure in chapter 19, we're going to be looking at the muscles within the tunica media and how it plays a major role in increasing blood pressure by constricting our arteries. Or, and here's where it can get really confusing, decreasing blood pressure by constricting the arterioles. Okay, so some slight variations. But for now, just identify the tissue. The tunica media is made of smooth muscle and elastic tissue. Now outside of that, all this tissue right outside of the tunica media is all the tunica adventitia, also known as the tunica externa. Okay, and that's mostly just fibrous connective tissue that's covering the protection of the artery. But when we go down to the vein, it's made of the same tissues for the most part. But the tunica media is much thinner. The tunica externa is much thinner. The tunica interna is the same because it's just endothelium. But you need to be able to look on high power and identify the tunica layers here as well. Okay? Even though it's a little bit more difficult to see all the individual layers because it's a very thin wall, you should be able to identify that from your slide. We also have the model here that kind of gives you a breakdown of the walls of the artery, the two tissue layers, and then as well as the vein. And so you can use this as a good model as well of the arteries and the veins. Okay, so that'll give you or help you a little bit also. Okay, so just identify an artery from a vein, and then the three major tissue layers that are involved. The bottom part there, identifying the nerves and the axons, fascias, don't worry about that. The one last part I want to mention, again, we'll get to this a little bit more later, but part B there, the vasa vasorum. What do you think that means? Vasa vasorum. What did vasa nervorum mean?
It supplies the nerve.
Yeah, blood vessels and a nerve. So what do you think vasa vasorum means?
Supplies the aorta.
Yeah, blood vessels to blood vessels. These larger arteries, like the aorta, like some of our larger elastic arteries, are so thick-walled that they need other small blood vessels to innervate this outer connective tissue and parts of the tunica media to make sure that they're getting enough supply of oxygen and nutrients. There's such a high pressure flow of blood through there that you're not getting any oxygen and nutrients dropped off. So they'll usually have these little blood vessels that come out, that branch out and connect to the outer coverings of these larger vessels, these larger arteries especially. So that's just a term that we're not going to see any of those. We're not going to identify. I just want you to kind of be able to define it and understand that some blood vessels do have blood vessels attaching to them. Okay? And the reason why that becomes important is as we look at, flip the page over to page 86, part B, under cat dissection. Those are all the blood vessels that I expect you to be able to identify in the cat as well as from the diagrams. And you say, wow, that's way too many.
86.
Okay. The reality of it is, in our body we have literally hundreds of miles worth of blood vessels. And the bigger your body is, the more blood vessels you have. What you have here on this page is less than 1% of all the named blood vessels in the body. So I'm being nice. I mean, that's not very many at all. Okay? But as we start dissecting the cat, you're going to need to make sure that you can go through and identify all these major blood vessels. And these are the only ones that these are some of the major ones that I really want you to focus on and make sure that you can identify. Okay? There's, like I said, a lot of others. There's several that you're going to see that look important, but I'm going to say, no, forget about that one. It's not important for now. But these are the ones that I'm going to hold you responsible for on the cats and the diagrams. So what I want you to do over this weekend is I want you to read through the chapter 19 and kind of familiarize yourself more with these blood vessels, their locations, their connections to other blood vessels, and so on. Because in order for you to really understand the blood and the blood vessels and their connections to the heart, you need to understand how they fit together. And the same example I used with all the other labs today. Okay, you all got here somehow. And you know how you got here from your house. And you know how you're going to get from here back home after you leave the state. But most of you probably don't know all the street names of the streets that you drive on to get from here to home or from home to here. You might know a few of them, but you know, you got this one and that one, and then you go that way, and then that road, and then eventually on the freeway, and then there's a lot of roads there that I can exit off of. Well, you're not going to get that luxury. You have to know every road. You need to know every exit. You need to know every turn. Okay, of these blood vessels. Because one of the things that I want you to be able to do is see how all these blood vessels interconnect with each other. Blood in the arteries always flows away from the heart. That's important. Blood in the veins always comes back to the heart. That's important.